the first is on the documentation end. All the data documentations, thinking about it, you can just say what you want to document, and then it just automatically transforms that into text. The other is you just write a couple of keywords, and then the system automatically generated. You just need to do manual editing on those. So those are, the advancements we can foresee in the future. Actually, there are companies already claim they have the solution already deployed, and tested and all that. But those are things are, probably in the near future on the documentation end. The other is on the data processing end, which I touched a little bit earlier. How NLP, now large language models, really can process all the data to make them extract all those data into computable format, and then you do analysis around it. So another way to think about it is, let's say, now you have all the data, you can actually do we call it a real-time NLP, which is very hard to do. I was consulting a company before many years ago. They actually was thinking to do a real-time NLP, which is very hard because a lot of computation burden behind it, and also implementation takes a very long time. But now large language model make it a lot easier and faster. And thinking about it, so now you go to doctor's office. So for the doctor to understand your history, and then you spend 15 minutes really give the picture of, where you come from, what do you do, how your disease is really coming. But now the provider open up the application EHR, they already see the patient journey type of data to really see across the timeline, your lab test, your disease, and your medication has been given. So data summarization, visualization become a lot easier nowadays with the technology.